C3 Foundation's Physician Outreach Program was officially launched in the spring of 2016 to educate medical professionals about the science of the Sinclair method and to give them the tools to add the treatment to their practice. The idea for the program came in response to a recurring problem. People would learn about the Sinclair method through the C3 Foundation's website, social media, and through our award-winning documentary film, One Little Pill. They would research the treatment, verify the science by reading published scientific papers, and they would head into their doctor's office and ask for help reducing or eliminating their alcohol use. And their doctors would refuse. These hopeful, motivated people were being told things like, just go to AA, and you have two choices, stop drinking or drink yourself to death. No pill can help you. Others were falsely being told they could get addicted to naltrexone, or that the doctor needed a special waiver from the DEA to prescribe the medication, because they confused the opiate blocker with similar-sounding drugs like methadone and Suboxone. We could see that people were highly motivated to change their relationship with alcohol. But the biggest barrier to change was the very people who had the power to help them. We knew there were doctors who truly wanted to learn how to minimize the health risks of alcohol for their patients, but many simply didn't know how. So we set out to find them and provide them with resources about the Sinclair method. The Physician Outreach Program was designed to help patients by helping their doctors. But without funding, the program took almost 3 years to develop before we could launch. We started with a list. We knew of about half a dozen providers who used TSM. We designated these as verified. The rest of our first list of providers was based on suggestions from people who would give us the name of their doctor because they were able to get a prescription and do TSM. Once each individual provider had been contacted and spoken to, and we could ensure they understood TSM, we'd mark them as verified. For the first 2 years, all educational material and contact with doctors was done on an individual, one-by-one basis. It was time-intensive and not efficient at all. In 2015, the Centers for Medicare and Medicaid Services released an unprecedented amount of data that allowed us to identify every medical professional who prescribed naltrexone under the Medicare Part D program in 2013. We were able to identify about 2,100 U.S.-based doctors who had prescribed oral naltrexone for any reason in their practice. Almost 40 volunteers banded together and dedicated hundreds of collective hours to create an address list. The volunteer enthusiasm, combined with a couple of successful fundraisers, allowed us to create a dedicated website for medical and mental health professionals and formally launch our program the following year. Since 2016, we have added telemedicine providers to our listing, created a mass educational mailing to the CMS doctors, and seen our network of providers grow from a handful to nearly 300 TSM providers globally. By June 2020, there was a coast-to-coast availability in Australia, Canada, and in all 50 U.S. states, as well as at least one TSM provider in a total of 16 countries. But there is still much work to be done. The Physician Outreach Program is the C3 Foundation's most time-consuming and cost-intensive program. Whether it's traveling to exhibit at addiction conferences or running a conference of our own, our efforts are limited by available funding. We estimate it will cost more than $100,000 to adapt our current educational materials into a self-paced Sinclair Method training program that can be used for continuing medical education credits. That's on top of the approximate $25,000 a year it takes to keep the program running. The Physician Outreach Program is our most critical undertaking because doctors and nurses are the people with the ability to empower their patients to make healthy choices. So if you or someone you know is a medical or mental health provider who uses the Sinclair method, Let us know and we can list you on our website so people can find you. And if you have the ability, please consider donating to help us continue our life-changing work. Thank you.